meeting, so I do apologize for the lateness of letting you know that. So we just started the recording. But if there are any questions, please consider placing this in the chat questions so that we can make sure that we can get to them either during the show or after. So we have about approximately an hour. We're not going to confine ourselves if there's some dialogue that goes on and over, or if we go too short, we're not going to sit here with dead awkward air. So thank you for joining the health team here. We have Dr. Amy in the house. So I'm John Greendeer. I'm serving as the moderator today. There's really not much to moderate. There's going to be a lot of information. If you don't have any questions now, I guarantee you, once you listen to Dr. Amy for a little bit,
the new vaccine data, the dashboard, and the Johnson & Johnson.
At this time,
okay.
I'm going to turn it over to Dr. Amy. And
okay. Do you want to? Will they flash the camera to you, or do you want to? Do you have to sit over here?
I'm going to see if I can get this
just try it.
live streamed as well. So thank you very much for joining us. So I'm going to turn it over to Dr. Amy. It's all yours.
Thank you. Good afternoon, and thanks for spending your lunch hour with us. My sidekick, Kiana Bodine, is not able to be with us today. As a result, Jennifer is. So we have a list of questions that people have submitted to our website. If you want this, I can pass that back to you. And we're gonna she's gonna do the first half and I'll do the bottom half.
Hello, everyone. Thank you for joining us. My name is Jen Baird, and I do the infection prevention and employee health for the Department of Health, and have been one of the COVID vaccine coordinators for the health department. So the first thing we kind of wanted to share with you guys, and I'm not sure if John, you can share, is the new vaccine data dashboard that the Ho-Chunk Nation Department of Health has published. You can get to the data dashboard by going to our health webpage, which is at health.ho-chunk.com. So John will pull it up here for me. I put him on the spot. Can you go back to the home page? Because it has there's a new vaccine one as well. So the one John's showing you is our case count. Right at the top there's a fancy link that says Ho-Chunk Nation COVID-19 vaccination dashboard. And for anyone that's interested, this is updated with all of the vaccination information. So it will tell you how many first doses we have given, which is just over 1,800. So we are doing really well in getting vaccine out. We've done over 300 second doses, which means that they are done with their COVID vaccine series. They've gotten both doses. And it also will show you some information about who's gotten the vaccine, whether they're tribal or non-tribal, if they're male or female, if they're in a certain age group, and where in our county maps those people live. So it's a really useful page. We do update it after our events, so please keep an eye on that. The other thing that might be helpful is it will show you which vaccination tier we are on. We are currently on tier 2B. And on the left, there's a description of who those tiers include. So that's a great resource. It's something that our staff has been working hard and getting put together. So please feel free to keep your eyes on that and get some updates there or on our health webpage. Talking about vaccine, the second thing is, I know a lot of people have been asking about the new Johnson & Johnson vaccine, the single dose vaccine. Johnson & Johnson has applied for what we call an emergency use authorization through the FDA. So basically they have applied to get approval for us to give their vaccine. The FDA is scheduled to review the data from their studies and make a decision on whether or not they feel it's safe and effective to give that vaccine late next week. So we will be getting more information. This vaccine is different than the other two vaccines that are currently available. So right now, Pfizer and Moderna are both vaccines that we have available. The health department has been giving Moderna specifically, is what we've been allocated and given from the state. This vaccine is a little different. It's one dose instead of two. It's also a little bit different technology. So there's been a lot of information about the Moderna and Pfizer vaccines that they are what we call mRNA vaccines, so messenger RNA vaccines. The Johnson & Johnson vaccine is what we call a viral vector vaccine. So it uses the same principle of taking the instructions on how to make an antibody, the protein that helps your immune system recognize diseases and fight them. It takes that information and gives it to your body, similar to an email, I think is the example Kiana used previously, and helps your body have the instructions on how to fight that disease, recognize and fight it. The difference is how it gets delivered. So with the current vaccines, it uses that, like I said, that mRNA technology. This vaccine uses what's called a viral vector. So it uses a virus that has been modified basically to do the same thing, to give that information to your cells and your body without actually causing illness. So it does not cause either coronavirus or that virus that they use as a vector. Overall, it has slightly lower effectiveness from the data we've seen. We will have more information soon, but it has been what we would consider for a vaccine very effective in reducing severe illness, which is very important. So there will be much more information coming, but at this time, it has not been approved yet, and we do not have it yet.
Do you want to talk in the new variant strains?
Oh.
Sorry.
And
Last-
sorry, we swapped tasks. So I'm going to talk about one more thing. So many of you may have been hearing about some of these new variants, which are, changes in the virus DNA, if you will. So it's changes to the genetic sequence of the virus. There have been a couple different ones that you may have heard about either on the news or in talking to people. The one it's called the UK variant because it was first kind of found in the United Kingdom. What they have found about that is it seems to be slightly more contagious, if you will, infectious. So it seems to be easier to spread and share with others, but they have not seen yet that it's causing more severe disease. So it's not making you more sick, but it is making more people sick because it's spreading more easily. There's many other variants. It's natural for viruses to mutate. That is something natural that they do. So we should absolutely expect there will continue to be more variants. So I don't think anyone should be panicked or worried at this point. Governments all over are continuing to watch and monitor the situation. And also at this point, the vaccines that are available appear to be good matches still. So they still seem to be effective against these variants. So nothing to worry about at this point, but just wanted you to be aware that yes, it's natural for viruses to mutate. We are aware that they have had some variants, and the government and health departments are closely monitoring that.
Okay, and I have it up now. Thank you, Jennifer. So I am going to talk about some of the changes in the clinic, both the clinic at House of Wellness and at the healthcare center in Black River. In the month of March, we will be doing vaccinations every week. As a result of simply people power or staffing, our services in the clinics are going to change somewhat. So most of the time, we will be doing urgent care visits only. So I don't know if that will continue on into April, but for sure the month of March, we will continue to do urgent care only. If you are somebody who has a chronic disease and you have not been seen by a primary care physician in 6 to 12 months, please call us. We will make exceptions. So there's that. And the next topic is why I got vaccinated. So I just had my COVID #2 vaccine last week. I do want to say that it came a little bit later than my 28 days. I think that was one of the questions we're going to field later. So the important thing to know about that is that with the Moderna vaccine, which is what we're distributing or what we're administering, you get number 1 and number 2 28 days later. You cannot get it any sooner than 28 days. You, however, can get it later than 28 days like I did. So I had a sore arm again that lasted 2, maybe 3 days. No other sequelae. I know some have experienced body aches, chills, fever after number 2, but fortunately, that did not affect me. So, so please get your vaccination. We will, is this a website we're going to do, hashtag why I got vaccinated? We want to know.
Oh, we can hashtag it.
Okay, yeah.
Either way.
Okay. So I think if that's something you decide to do in terms of social media and putting it out there, the more people who are aware of your decision to get the vaccine, the more it'll influence others. And like I said, please, if you are eligible to get the vaccine, the other thing I want people to know is starting next week, we will be giving the vaccine to all tribal members 18 and over and their household members. So please help us get the word out that if you are 18 or over, and that's because the Moderna vaccine can only be given at this point to those 18 and over, that you are eligible to get it. You can pre-register. We're doing that on Tuesday here at the House of Wellness, right? And then Thursday at the at District 1 Community Center in Black River. Let's see. Oh, masking. To double mask or not to double mask. So we've had some conversation. Dr. Fauci had made a recommendation that 2 is better than 1, something like that. I think when it comes right down to it, if you've got 1 mask, please wear it. I go enough places in Baraboo to the grocery store, for instance, and I'd say 90% of the people are wearing their mask. And then I'll come across, a couple who are not masking. So whatever, if you wear 1 mask, I think that is enough to stop your spread of potential respiratory droplets and protect you from other people's respiratory droplets. Did you want to say anything more about the double
Sure.
masking
And I
versus?
think the other thing, like Dr. Amy said, is making sure you have a mask that's well fitting to your
Mhm.
face is more important than having multiple masks that don't
Mhm.
fit well. So
Mhm.
you want a mask that's covering and sealing to your face, across the bridge of your nose, against your cheeks, and all the way down below your chin. If it's not, then you want to get a different mask, because if it's super loose, or your nose is hanging down, or your chin is up, many of these variations that I've also seen at the grocery store, it's not having the same level of protection as a snug mask across your face. And like she said, if it fits correctly, it will keep those particles closer to you and decrease the likelihood that if I cough or sneeze, it's gonna reach Dr. Amy. So more important than double masking is making sure you have a mask that fits correctly. Also, if you're using cloth masks, make sure you're washing and drying and caring for those masks appropriately, because that matters as well. Once things get wet, it's easier for germs to get through them. So switching them out, making sure you're washing and drying them, because, when we cough or talk in something all day, we are getting germs in there. So if you're letting that sit, we want to make sure you're washing, just like you would wash your clothes, wash your masks and take care of them.
Thank you for that, Jen. The other point on masking is one of the easy ways to see if it fits or it's on there securely is if you have glasses. So I noticed Jen has glasses, but if you wear glasses and you put them on over your mask and they steam up, that air is getting out. And so you need to really work on pushing that wire over your nose so that air doesn't get out. So if you want to test to see if your mask is snug fitting enough, put a pair of glasses on and see if they steam up. And then really work on getting that over your nose and under your chin. So just an extra tip. Let's see, what to expect after your vaccine. Again, Side effects, there are side effects to any vaccine. There are side effects to getting the COVID vaccine. They are minor, they last 2 to 3 days, and then resolve completely. So again, arm soreness is the #1 most common side effect. And then, of course, there are the more systemic side effects like headache and body aches, that sort of thing. And that is a sign that your body is working. You've got a robust immune system. It's been activated. It's working. So take that all as a sign that your immune system has been triggered and it's working. And unfortunately, you're feeling your body's immune system being activated with those more systemic side effects. Headache is another one. So if I didn't say that, let's see. Oh, I don't know if so they're basket weaving flyer.
Yeah. I can throw some of the questions because we are
Yeah.
getting the questions in the
Oh, good.
chat as
Okay.
well, but we also have some scripted here
Yeah,
that might be patient specific. However, it could apply to a lot of other folks. So the first one is, I am a legal guardian of a Ho-Chunk youth, but I am not Ho-Chunk. Can I sign up to get the vaccine when you have them at House of Wellness? And what type of proof do you need me to bring if I can?
the short answer to that is yes. As of, like I said, next week, we will be immunizing anyone 18 and over and household contacts. So this person who's a guardian of a Ho-Chunk youth is eligible to receive that vaccine starting next week at both clinics. Yeah, well, does the youth have to be above 18? Well, the youth can't get it, but the legal guardian can.
Next one is, hello. Will you be doing any traveling vaccine clinics? It's
Okay.
quite a distance to either BRF or House of Wellness. For the Wausau, Wittenberg, Green Bay, Milwaukee areas, for example, I'm in Wausau and an employee, but also we have many elders in the area as well as employees at the Wittenberg Casino. I think the answer to this is probably going to answer a few other questions that we have on the scroll here.
Okay, so from what I know, correct me if I'm not giving the correct information, but we at this point are not doing any traveling vaccine clinics at this time. Like I said before, to set up the vaccination clinics takes a lot of people out of our buildings, and to put them here at the House of Wellness to work that vaccination clinic. So it takes a lot of people to do the vaccine clinic. So it's not as easy. For example, for instance, doing flu vaccine, that sort of thing. I do want to say that Medicare has some travel vouchers available. So if you are 65 or older and you have Medicare, there is some transportation available. And if you want more information, to call one of the clinics and ask to speak to the benefits specialist or the patient services coordinators, and they will be able to talk to you more. But there is some transportation available for those who have Medicare.
And for those unfamiliar with the vaccination process, we do actually have a produced video that will actually walk you through the process from being checked in and to being screened, to giving your consents, to actually getting the shot, to having your waiting room. So it does walk you through that process. The reason why I mentioned that is when you see how elaborate the footprint of issuing over 500 vaccines are, you'll realize that it's not a movable campaign. So the headquarters out of Black River Falls and House of Wellness have been more suited to accommodate those crowds safely.
Thank you for that, John. And like,
And I can post that link in the
perfect. So there's that video, but for those of you who have not undergone or participated in one of our vaccine clinics, it is just like John described. They'll ask you about symptoms, check your temperature, and then you go and check in with one of our front desk people, and then you go to another table and you answer more questions. sign the consent form, make sure you understand that what side effects there might be. And at that same table, you get your vaccination, and then you have to be observed for 15 minutes. So it's not, and like I said, and when we're giving on the order 500 vaccines in a day, it just, like I said, it requires a lot of people power. And for that reason, unfortunately, we cannot go to these outlying areas. So if you have anything to add.
And we recognize that there are a number of people who, for whatever reasons, may not be able to make it. But the message would be, if you are at all able in any way possible to make it to House of Wellness or District 1 for one of these events, that is absolutely the preference and you should try to do so. At some point, Health Department will try to figure out the logistics, and we have started looking into that. So we are in the very, very early planning stages of looking at going to Wittenberg and Nakusa and Toma specifically are the 3 places we're looking at. We have to figure out all those logistics. We need a space large enough to accommodate this, because it's important that we maintain social distance for everybody's safety, for the health department safety, for your safety when you come into these events. We have to have space to observe you for 15 to 30 minutes to make sure that you're doing okay before we send you on your way. And we need to make sure that we can accommodate the staffing it requires. So we are in the early stages. We recognize that at some point we need to figure out how to get into the communities, but we also need to get as many people as possible done at these large events where we have the capacity, so we can get the numbers that we need to do small enough that we can feasibly and reasonably do it when we go to those sites. So if you have the ability, please reach out, use the Medicaid options, reach out to family or friends if they're able to transport you, especially if they're in your household or they're eligible, bring them with you and do them together. But know that we are working on it. We do recognize we need to come to you as well. We're trying to work through all those pieces. So watch for more information.
And Cindy had posted in the chat some resources in the event that you do need transportation out to the vaccination site. So please look in the chat box. There are important resources that might accommodate to assist. We do realize that the 2 locations that we have does not serve everywhere. It doesn't treat everybody the same, but it's something that is worth making the trip for if you can make it out there safely.
Absolutely. And I want to say that because we're at tier 2B, right, that we are ahead of a lot of other states and counties in the tiers getting the vaccine. So I know personally people who are traveling from Colorado, from Montana to come to our vaccine clinics because they can't get them in the county or state they currently live in. So it is unfortunate, but if it's important enough for you, the drive is worthwhile.
So this next question deals with reactions outside of the standard sore arm. This one says, I had an enlarged lymph node in my neck after the first vaccine. Could this have been from the vaccine?
Yeah.
I'm gonna say no. So lymph nodes, put simply, filter your blood. And if you have a local infection of your throat, your ear, those lymph nodes in your neck will swell because they're activated. They're working to really get rid of that infection. So I would say a swollen lymph node is more of a sign of you had some sort of viral pharyngitis, you had a viral ear infection on that side, and that's why that lymph node was swollen. Again, a sign that your immune system is working. I have not had any other reports of swollen lymph nodes from either, one number, COVID vaccine number 1 or 2. Do you have any other?
I think the very detailed data from the trials had some small, I think less than 1%. So very small But as we give more vaccines, then that number becomes more likely to happen. Definitely, I think what Dr. Amy's saying is more likely than a side effect from the vaccine. I would say, just like we tell anyone, if it's severe or lasting more than a couple days, you should touch base with your healthcare provider. That's sound advice for any side effects that people are having.
Well, I'd still encourage everyone to use the chat feature here with any additional questions. There are just some questions out in the community regarding the vaccination process. I know the tier schedule was confusing for a lot of folks for eligibility, but now the tiers that we open have a much broader group. They're not as finite as getting the direct service staff there. They're starting to open up to general public and spouses as well. And so for that, the protocol is probably even more important, making sure that we can get people in and out. We still have a number of people that are choosing not to be vaccinated for whatever reasons. There's a lot of information. So just to reiterate something you'd mentioned in the last town hall, where does the Ho-Chunk Nation Department of Health get their information, their trusted information from, and what do we rely on rather than the hundreds of internet sources out there that have a million different theories about the vaccine?
Okay, great question. Always a good question when you visit your primary care person is, where do you get your information? Ask questions and find out our resources. So I think this is an excellent question about where we're getting our data from. So two that I know off the top, and Jen, if you know more, but the Centers for Disease Control, federal agency that has, and there's been some suspicion, but know that the people who work for the CDC are scientists and researchers and provide accurate data. It's the website I go to for almost everything. So very reliable. And the second, especially with this COVID pandemic, has been Johns Hopkins University. They too put out excellent data, tracking numbers, that sort of thing. So those are the two that I probably go to the most. I don't know if you have any other sources.
I definitely use those two the most frequently. The other one I sometimes go to is Wisconsin Department of Health Services. Wisconsin DHS has very similar information. They follow CDC guidance, but it will be more local and state information and data. So what actually is happening in Wisconsin and in our local counties. But yes, Johns Hopkins and CDC are definitely two of my go-tos as well.
So another notion that had come up early in the pandemic was the concept of herd immunity. And now that we've got the vaccine going, what does that mean in terms of the numbers that you and other healthcare facilities are providing to reach what they call herd immunity?
Okay, great question. So I want to start by saying that number that we have to reach in order to accomplish herd immunity has not been established as far for COVID. But let's say for, I don't know if I want to say Haemophilus, like a school age, like maybe diphtheria, tetanus.
Yeah.
But for, let's say, for example, for a childhood immunization that you would typically get before you start kindergarten, to achieve herd immunity is going to be 90%, or about 90% of the population has to get those same childhood vaccinations in order to achieve herd immunity. So a lot of people think, oh, I don't need to get that vaccine because I know the other kids in the classroom are getting it. When I think in the state of Wisconsin, we have not achieved herd immunity for a lot of the childhood immunizations yet. So that number, in order to achieve herd immunity, has not been established for COVID. So again, I think that it is another tool like hand washing, social distancing, and getting the vaccine are important tools to prevent the spread and really turn this pandemic around. Like, we're not going to get a hold of it until all of us do these things. And the vaccine is one simple tool. The more people that get it, the better. And I think we just need to watch to see if and when we reach that level of herd immunity. And I don't know if that's 75% of our population getting the vaccine or 90% of our population getting the vaccine. I don't know that we, yeah.
And Whitney did have posted in the chat a tool to determine whether or not you are eligible.
Correct.
So that's a link that we'll make sure is available so people can, don't make the trip for nothing that they're here. I'm sure we'll take care of you as it happens. And just to remind folks, I know there's a question of how do folks get the vaccine if they're all the way in Milwaukee? And currently you do have to make the trip here. There is no mobile vaccination unit that's going to be able to make it out there. So, so enjoy the beautiful spring weather that we have. And I assure you it's warming up. So the next question that I have, doesn't necessarily deal with herd immunity, but deals with the fact that the Ho-Chunk Nation is administering the Moderna vaccine and requiring at least 28 days for the second dosage. There's a lot of news about Pfizer and now Johnson & Johnson, one shot wonder. We had mentioned this before, don't mix the vaccines. I don't think that can happen how we do it in the processes, but are we using Moderna because of, I should say, why are we using Moderna? Was it first available or?
Okay. I'm going to let you answer that one.
I'm going to give you the hard one.
I don't know why we're using first come, first
Part
serve.
of the reason we're using it is because that's what the state has given us. So
That would've
we
been
are
mine.
happy to be getting it. The other reason is Pfizer, I think everybody remembers hearing, or maybe they've heard, requires ultra cold storage, and the storage and handling is kind of a nightmare, actually. You have to keep it very, very cold on dry ice. You only have a very short amount of time to use it. So logistically, places that already have that ultra cold storage capacity, so larger hospitals and labs that already have those types of freezer units, are easier able to accommodate that. So we've been given Moderna because we can store it in our regular medical freezers at that temperature, and we have a longer time to give it. It's stable at that temperature for much longer. So the other thing is allergic reactions. I'm sure everybody has heard about that. It has been more commonly seen with Pfizer than it has Moderna. It's still rare, regardless of which vaccine, but it has been seen more often with Pfizer. And so the recommendation has been that those kind of stay in those hospital systems where there's emergency services available on site to safely take care of patients if that would happen. We have not seen that with Moderna. We have not seen that at all. We've seen very mild reactions. We are prepared to deal with it if that would occur, but we have not seen that. So those are some of the reasons that we're giving Moderna at this time.
How do you know how much of the vaccine that you're going to be getting? Is that just like based on, I've seen on the national news that they've been trying to call in more of the vaccines. It's hard to correlate what's happening on the global network for the vaccines and how it actually relates to us. How do you know how much we're going to have?
Yes, that's like a tactical, logistical, yeah.
So the COVID vaccine coordinators for us, so myself and 2 other staff, shout out to Lainey Dreyer in pharmacy and Hussein Haroon in pharmacy. We have to submit what our current inventory is, and we have to submit what they call weekly allocation surveys to the state each week, requesting vaccine, saying which groups we're working on, how much vaccine we are giving in those next weeks. And they also can see our inventory in the Wisconsin Immunization Registry. So we submit those requests each week. The state finds out from the federal government what amount the state of Wisconsin is going to get as a whole. And then the state has big fancy calculus, way beyond my math skills, formulas that they plug it in and it spits out that all these vaccinator entities should get these number of doses. So we get an email late in the week telling us you are scheduled to receive this many the next week. And we don't know until that point. Sometimes it ranges, sometimes it's what we asked for, and sometimes it's not. Some places are not getting any certain weeks. So we've been very fortunate. They have been prioritizing us in turn, I feel, because we've been getting shipments regularly. So I think they recognize that A, we're doing a good job, and B, that we have a high-risk community and need to take steps to protect them.
I'm just thinking of these questions along the way. But as a community member, as a tribal member, with family, I'm an employee, I got my vaccination. I'm walking into a home of people that aren't vaccinated. I'm hoping I can get them vaccinated as well. That correlates to the amount of inventory and amount we're able to do. So given the trend of what we've been receiving, is there a goal that ICS or Department of Health is looking at to have all Ho-Chunks and Ho-Chunk families within the districts vaccinated?
I'm going to answer very generally
Okay.
and just start by saying we want to get as many shots into arms as we can. So if we have the supply, we want to administer it. So like I said earlier, starting next week, all tribal members 18 and over are eligible to get the vaccine along with their household members. Tribal employees, non-tribal employees who are 18 and over and their household members are also eligible. So like I said, we're at a different tier than other counties and states. And it's actually a good thing because we want to get as many people vaccinated as quickly as possible. That's all I'm going to say. I think it's another supply question, and we use what we get. We use as much as we can.
So this is a good one, and it came up before. I got my vaccination. I'm flexing because I got my second vaccination. So I'm superhuman, right? I can go to Tractor Supply.
Yeah.
I can go hang out at the supper clubs. I can go. Am I cured, or do I have a responsibility to continue masking and to continue hand washing? Because I never do. I'm just kidding. But continue social distancing because I could very well be transmitting that virus to someone else.
Right. So I think you answered your own question, John.
Well,
So
it was more of a
yeah,
rhetorical.
yes, yeah. So I think the point there is even after you've received vaccine number 2 and 2 weeks have passed, so your body has, built the antibodies that it needs to, you still have to wear a mask when you go out in public. You still have to wash your hands. You still have to socially distance. I wish we had a crystal ball and we could look and find out when all of this will end. But I don't have that crystal ball. And in the meanwhile, we do have to continue all those other safety measures. I do want to say, and I don't know the exact stats, maybe you do, Jen, that we have not seen much flu. In fact, here it is March, almost March, and I have not diagnosed any cases of flu. So I don't know what our local hospitals are seeing, but I think our hand washing and our social distancing are paying off with the flu anyway this year. So I do notice that as a clinician, that I think we all have a deeper appreciation for how germs can spread, certain germs can spread, and how important hand washing is. I'd be interested to find out what those flu statistics are, just because we are social distancing and washing our hands more often.
It was reminded to let the listeners know that all tiers going into the vaccination events are welcome to come in and join. In terms of your day at the vaccination events, how many can you get through? Just realistically.
We vaccinated close 446 people at the House of Wellness last week. At the District 1 Community Center, we immunized more than 500 folks. So what would we say over?
Some downtime, so we could
Right.
probably easily do up to 700 per day if we can get people to come in.
Awesome.
That's- And that, again, full circle, is a
Mhm.
part of the long time planning,
Correct.
coordinating,
Correct.
making enough mistakes to
Right.
make things a little bit easier for each person that's joining. And so that's excellent. Again, all tiers that are listed on that, we'll make sure that we resend that schematic that shows the tiers and who we're offering that to. Then finally, and I'm, kind of shooting from the hip here, but I did get some questions. I think we already answered some of these. Is the Ho-Chunk Nation not getting vaccine from the IHS anymore?
We get our vaccine from the state of Wisconsin and not from Indian Health Services.
When someone does get the vaccine, I hear you guys, everybody saying, drink water.
Mhm.
And I don't, as a health and wellness coordinator, that's my mantra. So I like hearing things like that. Why drink water? I mean, I see in the waiting room, you have beverages there.
Right, yeah.
How important is that to?
In general, water drinking is something very simple you can do every day to treat a number of things. We don't, and I'm biased with this, but I feel like we don't drink enough water. And so if you were to feel faint, dizzy after you got your vaccine, whether number 1 or number 2, the water just helps with blood pressure, that sort of thing. So I don't know if there's anything specific about drinking water other than if you have the common cold and you go you do a telehealth visit, they're going to tell you to rest and drink lots of water. One of my patients can likely attest to this. And it sounds like I'm talking about a horse, but you always want to stay well watered, well fed, and well slept, in terms of foundations for health. So one of the things I sound like a broken record, but things you can do on a daily basis to stave off infection or just feeling, getting infections is staying well watered, well fed, and well rested.
Tribal member lives in a household with 3 non-tribal members. Can they come?
Yes.
All right, I'm just throwing these ones out this time. Okay, here's Pandora's box. Pre-existing conditions coming into vaccination. Any deal breakers there?
Yes.
I didn't want to.
Yeah.
I'm guessing, if you want to
Yeah.
be specific.
Short answer is yes. And I'm
And
going
by
to get
deal breakers, I mean
Luckily,
people
not very
that
many.
cannot get the
Right,
shot
yeah.
because of the condition
Right.
that they have.
not too many. I'm going to give one example. It's about my mom. Hi, Mom, if you're watching.
She isn't.
But anyone who's getting chemotherapy and their white blood cell count is down significantly should wait to get it. So she was advised by her oncologist to wait until her cell count came up. So it did, and she got the vaccine. So if there's ever a question, like I think Jennifer has already mentioned, please consult your primary care person and talk to them. But there aren't a lot of cases like that. I think most of the time, if you have underlying conditions, you're at higher risk for getting COVID. So all the more important for you to get the vaccination.
And finally, what is V-Safe? I hear people talking about that after.
You were about to say something anyway.
Well, yes, I was just gonna add in terms of the conditions, the only thing that I would say is absolutely is if you have been diagnosed with COVID and you actively have symptoms and are in isolation still, we ask that you wait until you have fully recovered. That's not because it's an issue for you to get the vaccine. We recommend you get the vaccine once you've recovered, but it's a safety issue. We don't want any accidental spreading to staff or other patients. So If you have COVID currently, please wait till you've recovered and then attend one of our events once you have fully recovered and your
Yeah.
symptoms have resolved.
Perfect. Yeah.
Be safe, everybody's favorite. If you have not gotten your vaccine, you should come in to learn what Be Safe is, but it is a automatic program that was developed by the CDC. You can use your smartphone to register. And when you come to our events, we give you the information and instructions on how to do that. And it real-time tracks side effects that you're having. So it will send you a text automatically every day for the first week to check in on you, ask how you're doing, ask if you're having any side effects. And then I think it's weekly after that. It will also send you an automatic reminder when you're due for your second dose and follow up with you after that second dose as well. So it helps provide reminders for you. It also helps the CDC continue to monitor for side effects and safety and efficacy of the vaccine. And so we really recommend that people register for that. You don't have to, but it's definitely something we recommend. And we give everybody that gets the vaccine that information.
That information isn't just for the clients that receive the vaccination from Ho-Chunk Nation. This is a collective
Mhm.
Database,
Mhm.
so to track
Nationwide.
all of the.
Mhm.
Yeah.
reactions.
And I'm glad you mentioned that, John. I know earlier one of the questions was about people in outlying areas, so Milwaukee, maybe Minneapolis, some other areas. And I saw another question that I'm gonna kind of skip to just because it goes along with it. Are Ho-Chunk Nation members eligible to receive the vaccine at other care providers or through the state vaccination site? So the answer is yes. We want everyone to get vaccinated. And of course, we hope that we get the chance to care for you, but if not, please get the vaccine wherever you are able to.
Mhm.
It's more important for us that everybody gets vaccinated. So for those in outlying areas, there are other tribal clinics as well that you would potentially be eligible to get vaccine. You are also eligible whenever they get to those tiers in the county sites, other clinics and hospital systems, if you're a patient there, the state sites. So yes, you have lots of options to access vaccine if it's not through us. As Dr. Amy said, we're a little bit farther ahead, kind of a lot more ahead than some of the counties and states. So likely younger, healthier people have a much better chance getting it with us right now. But at some point it will be available through all of those means as well.
If I get my vaccine in Milwaukee, can I get my booster here?
You can. We ask that you bring your vaccine card. No matter where you go for your second dose, please bring your vaccine card. So keep it safe after your first dose. And that allows us to make sure that you're getting the same type of vaccine. So as you mentioned earlier, if you got Moderna, you need to get Moderna for your second dose. If you got Pfizer, you need to get Pfizer for your second dose. But if you went to Milwaukee and got a Moderna dose, you could come to us 28 or more days later and bring your card with you, and we can give you your second dose and we'll complete your card for you.
What is the difference between the first and second dose? Is it the same stuff? Is it a different amount? Can you tell us about if there's variation between the first and second dose?
So anytime there's a booster to a vaccine, so that first vaccine is priming your immune system and doing the same thing. Like I said, it's introducing a protein, your body recognizes it, it makes antibodies to it, and then you get the booster 28 days later. And I want you to think of that as sealing the deal. So now more antibodies have been created by your body to fight that specific viral infection. So think about that first one as a primer, and the second one is sealing the deal. I don't have to describe
That's
it.
good.
Yeah.
Following up on another question, what documentation would be needed, like a copy of a lease or a photo ID? Is there anything? And I know you guys are kind of a little bit later in the process with, consents and administering, but.
So if there's a question of eligibility, please pre-register. We have a sheet that we can go through and answer questions and determine if you're eligible or not. And I haven't actually seen it, but I think if they need some sort of proof, address, kinship, descendancy, that will be outlined.
I'll show you the COVID-19 vaccine eligibility tool.
Yes.
There is a link in the chat right now. So once you go to this Typeform platform, am I eligible to receive my COVID-19 vaccine through the Ho-Chunk Nation Department of Health? You just click find out. You'll see that the questions are bubble style, they're short answer. What can I call you during the survey? So that's a tough one for me. Call me John. John will work. And so it'll customize the questions. Yes, I bet you if I hit no, because I act younger than 18, I'd be booted out of the system. But I am over 18, and you'll start to get the gist that the program is pretty basic. They're certainly going to run you through the gauntlet of eligibility questions. Certainly, yes. So the questions are pretty straightforward. Are you an employee of the nation? And it says right off the bat, John, you are eligible to receive the vaccination through the Ho-Chunk Nation Department of Health. So, and then it gives you information on where to go. So the vaccination tool is in the chat, but I'm also going to make it available on the Ho-Chunk Nation Department of Health's Facebook page. We do Facebook because we are Gen Z, and no, I'm not. But we do use that primarily because that's probably got our greatest reach out there. But utilize the tool if you have any questions as to regarding your eligibility for the COVID-19 vaccine or anyone within the household of yours. So according to our social media expert, it was just posted on the Facebook page. So, and it's also sent through webmail. So utilize that tool. Thank you, Whitney, for putting that up. You hear Whitney's name a lot. You don't see her too often because she's always working. So she's always producing stuff. So that access is something that you can utilize and get out there to get vaccinated. So way to go. Thanks, Whitney.
And John, I was going to add, if you also look at the flyer that I believe is on our Facebook page and Nation website, it tells you which documents people should bring. So for significant others and household members, we are asking that they pre-register, and that way all they need to bring with is an ID to verify their address. Employees can bring either their employee ID badge or recent pay stub with their ID. Tribal members and descendants are being asked to bring tribal ID, CDID, or proof of descendancy. So please, if you can't remember what you're supposed to bring, please check those flyers and posts as well, because the information is available on them.
So do check the flyers, and our next events, I don't want to say one event, but we have 2 events coming up, which are covered in this flyer as well. On Tuesday, February 23rd, and Thursday, February 25th. On the 23rd, we'll be here at our current location, which is the House of Wellness in Baraboo. And then on Thursday, we'll be at the District 1 Community Center in Black River Falls. And so the doors open, was it 10 o'clock?
9 a.m.
9 o'clock. So a lot of my dagas are still sleeping about that time, but later on, they'll come rolling around 1 o'clock after they make chewy breakfast. So with that, I'm going to move over to any further questions. So yeah, we don't want to overtalk this thing. You know, I want to turn it over to both Nurse Jen and Dr. Amy to give us some parting thoughts and any discussion items that we need to consider.
My parting words are, I want to say thank you to all the community members and my family members who have gotten the vaccine. Even those, I know people who have contacted me and been a little ambivalent or unsure about getting the vaccine and have gone through with it and done it for their family members, the people that they live with. I also want to say that there have been deaths in our community, as many of you know, And while the cases are getting lower of COVID infection, we still have deaths. I just got an email 2 days ago from Gerald Ignace, their website, saying American Indians have the highest rate of death from COVID in the state of Wisconsin. So we are not out of the woods from this infection yet, or from this pandemic. So again, wash your hands, stay socially distant, wear a mask when in public, and get the vaccine if you can. Thank you.
What she said.
Yeah. And then the COVID, the basket flyer, did you want to do that?
Oh, John, do you have the basket weaving flyer? So as Dr. Amy said so well and eloquently, I hate to have to follow that. You know, I gave this example to our staff at a meeting the other day. It doesn't take just one tool to build a house. It takes lots of different tools and lots of working together. So everything we can do is just one tool we're using against COVID. Until we use all of them and, you know, use them all together, we're not going to get to a good place. So vaccine is one of those tools. Hand washing is one of those tools. Socially distancing, wearing a mask, staying home when you're sick, staying in quarantine if you are exposed, getting tested when you have symptoms, letting people know if they are a close contact of yours. All of these are tools that we can use. And when put together, we can hopefully keep our communities safe and limit the impact this disease is having on our communities. So John was kind enough to pull up a flyer that was created that kind of just signifies and symbolizes that message, that we all have a part to play, and if we work together, we can keep everyone safe and just kind of get our communities back to the place we want them to be.
And in the meantime, we're still a clinic, we're still a community health, we still have other responsibilities that aren't just COVID. And the services may be limited, but wherever we can find critical services that are needed, we've been able to fill those correctly. Good. And they just need to contact the departments and find out if they can get those services.
Absolutely.
Yes.
All right. So with that, yeah, we'll switch out here a little bit. There's a thank you already. Thank you. So again, this is John. I want to thank Nurse Jen and Dr. Amy here for sharing with us a lot of information. You'd think that not much has changed, but really the landscape is changing every single day. We're getting reports. I think the latest one on the news for you web surfers is that the life expectancy has gone down in 2020 for the first time. That's a real thing, you know, and we're constantly bombarded with, oh, it's just the flu or something like that. We're realizing that it's going to hit us, you know, in our communities, in our economies, but it's also hitting us culturally as well. And so this has been a real tough time for those who have cultural responsibilities, religious responsibilities, and you know, they're taking this very seriously, but they're but it's been difficult. These are times when our Ho-Chunk people would come together, find strength and unity in building our families together. And for the most part, we can't do that. And so I want to say an extra special thank you to the many Ho-Chunk tribal members, employees, community members, family members who are starting up their cultural podcasts, their language podcasts, their instructional learning tools, their Waikan or winter stories, you know, the many Zoom, I know we're all zoomed out of things, but thanks for filling in those gaps, those needs. You may not think because you don't have a lot of viewers, it doesn't matter. It does matter. We have to fill that little spot. And that's something a doctor or a nurse cannot do. So I want to thank you guys out there in the communities. You're helping us help you. Health is not just simply about protecting from the vaccine. You know, there's more to it, even more than eating right and exercising. You know, there's a whole spirit that we have to make sure that we're holistically addressing as well. So when this is gone, and it will be, we can come back together and we can gather again once again. So if you love your family, if you love your close ones, and you want to see them around, make sure you protect them from what's out there. So I want to say thank you to Dr. Amy again, Nurse Jen. Thanks to Pam Thunder for getting this all set up for us, the incident command team. When you get there, there's a lot going on. Give them a thank you, because when they're there, they're not doing something that they were either hired to do or something with their family. So thank you all very much. We'll have this recorded and we'll have this a link available very shortly once we can get this uploaded. So again, I'm going to sign off. Talk to y'all. Take care. Social distance. Wash your hands. Wear a mask.